Hello, my name is James Forbes. I'm 45 years old. I'm a personal trainer and I've just had a full hip replacement. I never thought I would need one, but apparently I was destined to have one as I was born with a cam deformity on the neck of both femurs, and this has gradually been wearing my hip down, especially my right hip, for the last 45 years. I used a surgeon called Professor Alister a.hart. We had the operation and procedure based at the London clinic up on Devonshire Place in London, and I cannot recommend both Professor a.hart and the London clinic enough. The hospital was absolutely fantastic. The room I stayed in was very comfortable, very well equipped. All of the staff, ranging from the nurses to the physios, to the cleaners, to the room service, were very attentive, very friendly, and very supportive, which made my recovery here an absolute pleasant stay. My procedure was a posterior approach. I had a titanium spike with a ceramic ball and a high-grade polymer cup fitted. The operation took about 1.5 to 2 hours, I believe. I was pleasantly out under anaesthetic for the whole of the operation, and when I came round, I was very well managed with pain relief, so was not in any pain or discomfort. I also had a drip fitted to my arm with a self-administered button where I could top up the pain relief at any time if I felt like I needed it. And the nurses routinely would come round and with each meal offer me any more medication that was needed to keep me comfortable. My stay at the London clinic lasted for around 3 to 4 days, seeing as the procedure on the first day was really only half a day by the time I'd come in and got prepped. So in terms of full recovery days at the hospital, I can say I've had 3 days. The first day we started very gradually with some basic physio exercises, learning how to, with assistance, move out of the bed safely, walk around the bed with a frame. On the second day, the physio progressed, for me at least, to using some crutches where we walked up and down the corridor and up and down some stairs. Again, the pain management was absolutely fantastic. I never was allowed to get to a point where, the pain became uncomfortable or unbearable. And again, the service at the London clinic was second to none. It almost feels like you're staying in a very nice hotel. My second full day, the physio progressed further still, and we were now walking up and down the corridor with a normal walking gait pattern and using the stairs again further to practice. I also started to have hydrotherapy, which was absolutely fantastic. The non-weight bearing manner of the water allows you to walk freely up and down, doing various drills that the physio recommends, and you can do this unassisted. And by day 3, really at this point, I was starting to feel much more independent, being able to get in and out of the bed myself once the catheter and the pain relief drip had been removed. At this point, I was still on pain medication via tablets, so I was advised just not to let any discomfort levels get to a point where I couldn't manage the pain. So again, this was very well coordinated by the team at the hospital, and really the hydrotherapy is absolutely invaluable. I would highly recommend for you to have this. On the third day, the physio progressed further, and we were doing more drills at the side of the bed. that I can now continue with at home, and have also been shown ways on how to progress these. It's now Friday, and I'll be checking out from the hospital tomorrow after one more final hydrotherapy session. But considering I've had quite an invasive procedure, having a hip replacement done, the pain relief has been fantastically managed here. The physio has progressed rapidly over the last 3 days, and I feel immensely confident to be able to continue with these exercises at home, and also be able to get back to gradually a more normal way of life. So if you are having hip surgery, I thoroughly recommend, if you're able and in the area, to either look at the London clinic, and I can only recommend Professor Alister a.hart, as he was my surgeon. If you were to use him, you would be in very safe hands. And I would urge you just to follow the physio's advice. Your journey may be different to mine depending on your age and mobility, but I wish you the very best of luck.